What's up, guys? Holden here, HMOM Fitness. Today I'm going to show you a way you can do a self-hip adjustment. Okay. So, physical therapy, they have similar techniques they do that can get that hip in the optimal position. Usually, if you're an orthopedic board certified physical therapist, they can do this adjustment. This is different than like a chiropractic adjustment. This is actually a lot better. Excuse me. This is totally different than a chiropractic because in this they're adjusting according to if you have like a posterior anterior tilt, while other variations if you have a high or lower hip. So for this is going to accommodate kind of if you have a slight movement of one side. You can check by standing and feeling where your hip bones are, if one's higher, one's lower. So this is what you're going to do. You're going to lay on the ground, okay, and you're going to push one leg, one hip, hard to explain. You're going to push one leg and pull the other. So like this, you're going to push and pull. You want to hold for 5 seconds and do it, push it and pull as hard as you can. So you gain some hip flexion pulling this one, and you're pushing this one. So like this. So you have opposite hands and push, pull, and then switch to the opposite. Okay, it's important to do that as hard as you can. Okay, so do about 5 of those. Okay. So that actually will move your hips a little bit. Okay. The next thing you want to do is take a water polo ball, any type of ball that's hard. You're gonna put it in between your feet leg. Okay. Right here, and make sure your feet are level, and you're gonna squeeze as hard as you can. Okay. And actually, right there, I got some pops in the inside of my leg. Okay, so on that, you're kind of getting it back in alignment. Okay, so that's what you're gonna do for the hip adjustment. It actually works. Kind of looks silly, but when you try it, you'll feel a shift. Okay, then from there what you want to complement it with is we want to loosen up these abdominal muscles that attach to that pelvis and play a role in how it moves. So we're going to do two little mobilizations. So first is you get the ball, simply you're going to land on it. Okay. So the thing here is you really need to relax. Okay. Really let the ball just try and really suck yourself over the ball and let the ball just kind of engulf you. So you want to hang out here. You really have to relax. And you're going to get a visceral response. You know, you kind of might feel your digestive system kind of go off. A lot of gurgles and stomach growls, because it kind of feels like you're being gutted. But what this is doing is loosening up all those abdominal muscles that attach to that pelvis and dictate if it has tilt or not, and so forth. Okay, so you want to hang out there for a little bit. That actually feels pretty good once you kind of get a rhythm of it. Okay, next thing you're going to do, you're going to need a bigger ball. Okay, right here's a shot put. Lacrosse ball, a little too small for this. So what you're going to do, preferably you want to have your legs up against a wall, maybe on a bench. Just have them elevated. It'll keep your back a little more neutral. So this is what we're gonna do. We're gonna go after that quadratus lumborum, okay? QL. So the QL attaches from the bottom of your ribs to your pelvis. Okay, so if that's pretty tight, that can dictate, if it's tight, it can bring your pelvis, put it in a little tilt, and it really has a role in your pelvic alignment and how your rib cage can come down. If it's really tight, it'll be kind of displaced. So loosening up this QL is very important because it connects two major structures, pelvis and ribs, and we just gotta get those baby things loosened up. Okay? So the QL is, if you guys can see this, the QL is not the erectors. It's not the one closest to your spine. It's on this more outer edge. Okay, for me, I have a pretty ropey one because it's just something we don't get after too much. So I'll take this, lift up the shirt so you guys can see this a little bit. Okay, so think right between your ribs and your pelvis. It's pretty kind of a thick sheet you'll probably hit, and that's probably it. Okay, and you just want to hang out there. Okay, so like I said, try and get these legs elevated onto something so you can kind of lie flat, get a nice flat back, and then try and get in there. Okay, so hang out there for a couple minutes. I'd say at least 5 minutes on this QL. Okay, so there you go, guys. Hip adjustment, and then from there we're gonna go after those muscles that play a role in the hip alignment. And obviously there are many others that play some sort of role, but those are just two that play a big part in that. So go after those abdominals and that QL. Okay, see you guys. So hip.